Good afternoon, this is your County Judge Executive Ricky Craig, and we called a special meeting here today, and we have been talking about this coronavirus, and we told the citizens of our county we would keep them updated on every situation that happens. Today we have our emergency management, Lucas Adler, with us, we have the mayor with us, we have our press with us, Alan Gibson, we have our county attorney, and we have Mr. Shawn Crabtree of Lake Cumberland Health Department. So right now, I'm going to go ahead and turn it over to Mr. Crabtree and let him fill you in on some information that we have.
Thank you, Judge. Thank you for your leadership and for everyone that is responding to these COVID-19 situations as they arise. I can say I work as a district director, so I have 10 counties, and I've been able to be really impressed with the way that the counties are coming together and pulling together as units with emergency management and the judges and the medical community and the health department all working together to try to do the best we can to deal with this rapidly evolving situation. What is COVID-19? I always start my presentation. I've done so many of these now, it feels like I'm saying the same thing over and over, but I got to remember I've got a new audience each time. So what is COVID-19? It's a disease that's called from one of the strands of the coronavirus. It causes a disease called COVID-19, or coronavirus disease 19. The 19 is for 2019, when this particular strain of the coronavirus made the jump from animals to humans. Back just a few months ago, this was a disease that was only transmitted, or a virus that was only transmitted animal to animal. Then it made the jump to humans, and shortly thereafter it made the jump to where it could be transmitted from human to human. Now, I've heard people talk about how it's like the flu or like a cold, and in ways it is, in that the kinds of symptoms and things you have are similar, and the way it's transmitted is similar, but that's sort of where the similarities end, because since this just got introduced to the human species, there's no one that has an immunity to it, which means everyone is susceptible to catching this. With seasonal viruses, you do have, the population has some residual immunity from the season before. With this, there is none, unless you've had it and gotten over it. As far as we know, no one has caught it twice. So it does appear that you develop an immunity after you had it once, and some people are in that category. Also, there's not a vaccine for it, unlike a lot of the seasonal viruses, so we don't really have a way to prevent this, other than doing the things that the governor and the commissioner of public health and the local authorities have been saying, things like social distancing. What do we mean by social distancing? If you're looking around and you see a crowd of people, you're probably in the wrong place. If you're more than 6 feet or within 6 feet of someone else, you're too close to them. This is a droplet spread disease, and meaning when you cough or sneeze out droplets, that's how it spreads. And you need to be 6 feet away from others to protect yourself from that sort of thing. Also, make sure that you're washing your hands regularly. If you pick it up off of something, you don't want to have your hands contaminated and touch your eyes or your ears or your nose or your mouth and pass it along that way. So wash your hands well. When I say wash your hands, I can say most people don't wash their hands well enough to actually deal with viruses and bacteria. You need to wet them, lather them up with soap, and lather them up really good, front of the hands, back of the hands, between the fingers, fingernails, for about 30 or 45 seconds before you rinse. Certainly, if you feel sick, you need to stay home. You need to be covering your cough as much as you can so you're not spreading it out. In that regard, the public can be our biggest asset, or the public can be our biggest liability. It can be our asset by following those directions. In a few minutes, I'm going to give you some examples of what happens when you don't follow these guidelines. Let me give you an update of where we are in our district right now as far as cases. This was as of the moment that I left my office, and it's probably changed since then because this is growing exponentially. Right now in the district-wide, as of when I left my office, we have had in our district 39 cases across our 10-county district. We still have 31 of those cases are active. Some 8 of them are no longer active. 7 of them have been on isolation, and they've recovered, and they've been symptom-free long enough that we feel they're no longer concerned. They've been released from isolation to go on and live their life. One person passed away. That was a very sad situation. I had to go and do a press release with the judge in Pulaski County yesterday to announce that situation. So this can be a very bad outcome with this disease. We have had a total of 3 cases in Adair County. We have 3 of those are on self-isolation. And, 2 of those are on self-isolation. One of those, I think, is in the hospital. And, one of those was a resident of a long-term care facility, which complicated things. This morning, or late last night, we found out that it had gotten the virus that had been contracted within a nursing home. So we had to get our plans together really quick, get to the nursing home, and make sure we have plans in place to protect those staff and residents. Today we had a meeting with most of the emergency managers and nursing home directors through Zoom. We didn't meet in person, but we were able to give guidance and make sure that they had good preparedness plans in place and good response plans in case they get a case. We want them to know how to prevent it. We want them to know what to do if they get one. So that work is in motion and progressing. No cases in Casey County so far. I expect that will change within the next couple of days. We do have now 1 case in Clinton County. Last night we thought that was a Wayne County case, but when we GPSed it, it actually is a Clinton County resident. So we're announcing that as a Clinton County case, even though this person has probably spent most of their time up in Wayne County. Now, this is the first Clinton County case. We have reached out to the Clinton County case. We've done our case investigation. We've identified the close contacts, and we've either completed or in the process right now of completing our close contact investigation. We isolate anyone who's positive, a case, and we quarantine folks who are close contacts. When we do the interview with them, we determine whether they're low risk or high risk or medium risk, and depending on how you come out after that survey, we would quarantine you or not, or restrict you in less restrictive ways, but quarantine for 14 days would be the option there. When I say quarantine for 14 days, that's 14 days without symptoms. If you end up with symptoms somewhere in the middle of that, the restrictions would be longer. We have 1 case in Cumberland County right now. That case is on self-isolation. We have had a total, at this point, of 24 cases in Pulaski County. 2 of the Pulaski County residents are hospitalized, 1 in UK, 1 in Lake Cumberland Regional. 16 are self-isolated, 18 total active. 5 of those have been released now from isolation, and we had, of course, 1 pass away. In Pulaski County, of those 24, at least 12 of those was related to 1 church exposure, and the person who passed away was unfortunately involved with that situation. So it is important, churches, the average age of people who attend church seems to skew high, so that the target population or the high-risk population, there's going to be a good percentage of people there who are in that 65 plus age range. So if you're 65 plus and you're going into a small room for an hour or 2 hours with other people, that's not an ideal situation. It's not just church, but church tends to skew high. But if you're anywhere where you see you're around a group of people, you're probably not in the right place. Russell County, so far we've had a total of 2 cases. Both of those are on self-isolation. In Taylor County, we've had a total of 3 cases. 1 of those is in Taylor Regional Hospital. 2 of those are on self-isolation. In Wayne County, we've had a total of 4 cases. 2 of those are in Lake Cumberland Regional Hospital, and 2 of those are on self-isolation. So that's where we are right now in our district. So you can see it's growing very quickly, and it's getting more complicated. It's more difficult for me to be able to keep up and even give you a report of where everybody is and with that. But where do you need to get information at? Well, of course, the state has their website. We have a website, Lake Cumberland District Health Department. When you go to Lake Cumberland District Health Department, you'll see a COVID-19 banner. You can click that. It's got all kinds of local information. It's got all the updates that I've just given you from the night before. Shows some trend charts and so forth. It's got links to the CDC's webpage and the state's webpage, where there's all sorts of resources about how to take care of your family and your job or whatever it is you're doing. There's resources for about every scenario you could think of. If you have general questions about COVID-19, I would encourage you to look at the website first, but if you don't have your answer, if you don't find your answer there, you can call the state hotline, 1-800-722-5725, 1-800-722-5725. That's 1-800-722-5725. I mentioned that we're trying to protect our highest risk population, those 65 plus, and those with compromised immune systems. We can already see in our district a significant number of people who have come down with COVID-19 are ending up in the hospital. So when we talk about flattening the curve, this is what we're trying to do. We're trying to prevent too many people from needing to be in the hospital at once. Since there's no cure for this, since it's community spread, since it's growing fast, we expect it's going to run its course through the communities, but we don't want it to run its course through the communities so quickly that too many people get sick at once and can't get into the hospital if they need it. So we do need you all to continue to social distance, to self-isolate, wash your hands, cover your cough, all of those kinds of suggestions so that not too many people are getting sick all at one time. What should you do if you think that you've been exposed to COVID-19? Well, you can go to our website for information. You can call that 1-800 number. That's 800-722-5725. If you feel sick and you don't feel like you're sick enough to go to the doctor, it's perfectly fine to stay home and try to work your way through it until you feel like you're sick enough to go. That's a perfectly acceptable response. Of course, if you get to the point where you feel like your life is in danger, having trouble breathing or whatever, certainly call 911. Or if your condition you feel like it's getting worse. If you think that you need to be tested, my advice to you would be, I don't know where you can go, but some doctors are testing one week, some go off from testing as they run out of kits or just get overwhelmed with it. Some new doctors come on the next week. I would encourage you to call around. Make sure you know that the place that you're wanting to go to has the ability to do the testing before you go mingle around trying to find a place to test. Allow them to screen you over the phone because there are a limited number of test kits. Even with a bunch of private labs on and doing testing now, there's still a limited number of test kits. So make sure you're a good candidate for testing before you just show up. After you've found out if the facility is testing, and after they've screened you, follow whatever directions they give you, because the staff there want to protect themselves. If you're a candidate, they want to wear the protective measures, the protective equipment, and take measures to make sure that they're keeping their staff healthy, so their staff can continue to provide the medical services. Again, I emphasize to you the message of social distancing, covering your cough, staying 6 feet away from each other, staying home if you're sick, washing your hands regularly, not touching your face, nose, mouth, and so forth. This is growing exponentially in our district. Right now, it's spreading at a 1.21 growth rate. Now, if you don't understand what that is, it means it's growing about 21% per day. But to make that a little bit easier to understand, that means that the total number of known cases is doubling about between every 3 and 4 days. So that's what we mean by exponential growth. The other day on 4/2, I put this little chart together. We had 26 known cases then. If the trend of doubling every 3.64 days continues by 4/9, we would have been at 98 cases in our district. By 4/16, about 375 cases. So it's growing quick. Now we want to do better than these projections. How can we do better? If If everyone will be an asset to our response and will social distance, avoid crowds, cover your cough, wash your hands, the things that we've been saying, we can slow this down and not overwhelm our hospitals and our medical providers. I was also thinking about, we have in our 10-county district a population of just over 200,000 people. I round down to 200,000 to make math easy, but if you have just 1%, they're going to disregard the rules and go out and do what they want to do. Well, that would be 2,000 people going out and doing things that they shouldn't do. 1%, 1 out of every 100. And if 1 out of every one of those 100 actually ended up contracting the disease, that would be 20 people that would get exposed and catch this that wouldn't have otherwise done so if they would have honored our restrictions. What kind of damage can 20 people do when this is doubling between every 3 and 4 days? Well, 20 people in a week would expand to 76 people. In another week, it would expand to 288 people. Of that 288 people, 55 of them would be in our elderly population statistically, since we have a 19.1% of our population in that age group district-wide. If the state mortality rate of 1.2% applied, that would mean, or 2.23% applied, that would mean just a little over 1 person statistically would pass away because of that 1% of the 1% who caught it. Now, the mortality rate for the people in our high-risk group is way higher than the overall mortality rate of 2.23%. The mortality rate for our elderly population is somewhere between 20 and 30%. So you can see now that 55 people, well, 10% of them would be 5, 20% of them would be 10. You're talking about a lot of people that's going to have some extremely difficult circumstances because you chose to go out and disobey the rules. So I would really, really encourage everyone, take what we're suggesting seriously. We don't need that many people having to go to the hospital at once, so do your part to be a part of Team Kentucky, social distance, cover your cough, stay 6 feet away from each other. If you feel like you need information, go to our website, call that 1-800 number, 1-800-722-5725. If you feel like you need to be tested, make sure you call your provider in advance to confirm they are testing. Allow yourself to be screened over the phone. Follow their directions. There is a handy tool it's actually on the CDC website, but it's linked from our website where you can go in and fill out a self-assessment. It's a widget on their website that'll just lead you through a series of questions, and you answer them, and then it kind of tells you at the end what your risk level is and what you need to do. So that's a handy tool too. So, Judge, do you have anyone else that wants to say anything before I offer to take questions?
Yes, Lucas, our EMS Director, Lucas Allen.
Obviously, we'll let Mr. Crabtree answer the questions for the district. As we told you and we followed through with this, we let you know that we would follow up with the county. We would keep you informed. And today, as we knew it was the inevitable, but we are making sure that we're informing you that we now have 1 positive case in our county. Like I said, it's a hard speech to make for all of us here today, but we knew that it was something that we would be doing. One of the things that I want to make sure that I talk to you about is avoiding the crowds and gatherings, like Mr. Crabtree said. I was in a store here today and I noticed that there started to be more people filter in. I made my exit, and that's what we're asking you to do the same. We can't make sure that everyone is following that, but if you do it for yourself, you're covering yourself. Follow the social distancing, like the governor said. You can still be outside, you can still take walks, be your family, but do that 6 foot away from other people. Like Mr. Crabtree said, follow the hand washing, and for me, the big one I want to explain to you is know when to seek care. Because as Emergency Management Director, I'll also be the EMS Chief here. So, know when to call 911. If you feel that you have an emergency, call 911. And also inform dispatch of your symptoms, but they will be asking you questions as well. We will be coming in our appropriate personal protective equipment. Don't be alarmed. This is to protect you as well as to protect our crews. As Mr. Crabtree said, the older population are more apt to have issues with this. So always remember, just because we're transporting you this run, the next run we may be going into our local nursing home or another nursing facility. So we're in contact with those people as well. So we're taking added precautions, wearing the personal protective equipment, we're disinfecting our trucks after every run, as always, but we're going a little more in depth with some extra bleach, disinfectant, and doing a little bit more now than probably we ever have. So, always make sure that you're not scared. We're there to help you, and if you feel you have an emergency, feel free to call 911. That's what we're there for. Like I said, one thing, we're checking our employees as they come in daily. We're also checking them as they leave. And if they feel that they're sick, they're asked to stay at home as well. We're here to try to keep our employees healthy so we can keep responding, and we're prepared to do that. On our Facebook page, on the one that we take care of is Clinton County Emergency Management. There's no way, guys, that we can respond to your questions. There's no way that we can answer your questions or respond to those. There's too many. But we are keeping you informed on that daily. Please feel free to look at that, like it if you haven't already. We try to update that by 5 p.m. Central Time every day, and we'll continue to do that. As far as the test in this county, as Mr. Crabtree said, there's so many doctors and clinics that are doing that today that may not be tomorrow. So it's not always that we get informed of the testing that is going on at the moment or as it's being done. But they do inform the health department as soon as they have a positive case, and then they inform myself and the judge, and we will continue to follow up with our county. We'll let the questions go to Mr. Crabtree at this point.
Thank you, Lucas.
Anybody have any questions?
Did you get the current situation with the Clinton County case, quarantined at home or hospitalized?
Isolated. The case investigation has been completed, so we've made the contact, we've done the interview, we've given them their isolation orders, and we've identified who the close contacts are, and we have either reached out to all of them or in the process of doing that. They were working on that yesterday and today. They're probably wrapped up by now. They may have one stray person they're still looking for. They've assessed all of them, and they've either been quarantined or determined not to be at risk. The difference between isolation and quarantine, I don't know if I said that, it really kind of works the same, except you isolate someone who's actually positive for something. You quarantine someone that you think could have been exposed, but they're not a positive case yet. So it kind of works the same, but that's the difference.
Do you know the time frame that was involved in between when the test was administered and when the positive test came back?
For this particular
For this
case,
particular case.
give me a second.
Okay.
We have had a good turnaround time on our testing with the state lab, and there are several private labs that are doing a good, ideally 24 hours. That gives us, as long as the patient has come early in their symptoms and the test turns around quickly, we can get the case investigation done, and we can get to their close contacts and get their close contacts quarantined before they become contagious. The longer someone's symptomatic before they're tested, and the longer it takes that test to come back, the less effective our response, of course, will be. Trying to look on this particular case. This one was one that took longer than it needed to take to get the results back. So it looks like the lab was collected, as long as this was keeping correctly, about 3 weeks before we got the results back. So that doesn't help you a lot on your public health response. What that means is that we have to work a lot harder going extra steps, because now people you would have quarantined are a whole lot more suspect about could they be shedding by now. So it really makes the response. I know that I happen to also be the health department liaison to the state health operations center to give them advice from the local health department level, and just a few days ago I sent that in to the operations center. This is unacceptable, and that day the governor talked about that on his press release, so they got the message, and he was making a commitment to try to speed the labs up. These new labs that are coming on, we're glad that there's more people testing, as the governor says, but you know, places that are used to doing testing and for whatever test they're doing, a 14-day turnaround is acceptable. For this, it's not. And so it's a problem. And some of these labs that have come on and started doing the testing, you know, they've never done this public health type of testing where they even know that they have to alert the health department, and they don't have electronic reporting methods, and they're having to send stuff in by paper or call it in. And while we're glad there's more people testing, it gets it a whole lot more complicated to get the test read and the results back to us. We start the contact investigation the moment we hear it, and the case investigation the moment we hear it, and the contact investigations the moment after we complete the case investigations. But if we're a week behind, it complicates things, so you can imagine. It's what we're up against. It's a very complicated situation, and every day there's a new layer of complication to peel back. You know, we had a situation with a factory in Pulaski County who had put all of their employees on production off work. They kept their salaried employees coming in to continue to run the office. And an employee came to work and worked a few days contagious or symptomatic, and they turned back positive, exposed a lot of people. Now their business operation is shuttered for the rest of the month, and they've had to hire a professional cleaning crew to come in and sanitize the whole place. So, you know, it's these kinds of things can happen. You know, getting into the nursing home, complicated situation. You know, how do you deal with trying to prevent its spread in a very close quarters? You know, making sure that we get people separated into private rooms as quickly as we can. If it spreads enough, you can cohabitate or co-room people with positive cases in one room and try to put up a barrier in the room. So, you know, we've got some plans in place to try to deal with the nursing homes. The next thing is to try to figure out personal care homes and jails, and probably the jails are pretty far along in their thinking on this, and maybe thinking about, you know, if they've got folks in the high-risk population, having them in a separate part of the building than the other part, and they're, I assume, restricting access and visitors and all those things like they're supposed to be. But we will be assessing that more Monday. We got onto the nursing home thing today because we had a case yesterday. I wish I would have thought about this a week ago and got these plans in place, but I didn't, and we got on it the day the governor announced that it's starting to pop up in nursing homes. The light bulb went off in my head. We got to get on this, and that night we had one in a nursing home. So, you know, we kind of missed the heads up on that one. Fortunately, the nursing homes had already been given guidance, and you know, we're doing things. Now, whether or not they were taking it as seriously as they should have, you know, we'll give them the benefit of the doubt. Most people take it seriously, but we do want to go in and have our staff, if not go in, because you don't necessarily want people going into a locked facility, at least getting with the administrator on the phone or through a Zoom meeting and talking with them about what have you got in place, what are you doing, and my medical director giving them additional guidance, and then making sure that they actually have the response plan in case now you've got a case, what are you going to do? So a lot of complicated things to peel back. I'm sure the emergency management could tell you that this don't get easier day by day, does it?
No, it does not. And with that, Mr. Crabtree, to clarify Mr. Gibson's question, if these people go into the hospital with symptoms of sickness, they're asked at that point then to isolate themselves. And I think with your response to the answer there, I talked to your office earlier, that may have been a missed keystroke, I'm not for sure. But even though if it did take that time on the testing, once that person has come in with those symptoms and been tested, they're asked to go ahead and quarantine. Is that correct? Can you verify that? That's what they're asking the people to do?
As just the moment we are able to contact the person, we make sure they are isolated. Now, there's a considerable number of people that when they went to the doctor and the doctor felt like they need to be tested, the doctor went ahead and recommended they quarantine. So several cases were already taking measures Some not, but a lot of people, from the advice of their medical provider that took the test, already gave them good advice and they were already on quarantine, which is ideal. You want that to happen, so.
I know locally, the physicians that I've spoken with have said, even just somebody who isn't feeling well and they have visited their office or called, they told them to try to stay at home, don't be out. So that's where we're getting ahead of it, we hope, and that's what we continue doing to try to avoid it. And I just wanted to make sure that was how you felt as well.
Yeah, and I hope that was a key punch area. It could have been. We're punching in a lot of data really quickly, and maybe the lab was quicker on that one. But I've told you what I know, or what I think I know, and if I'm wrong, I'm doing the best I can. Other questions? Anything you guys want me to cover that I haven't?
No, I think you've done a wonderful job, and we thank you so much for keeping us informed.
Yes, sir.
We value you very much, so I want you to know that.
Yeah, and I value you guys. I mean, you guys are out there when we've, when this was starting to ramp up, and I asked my local planners to get you all together and make sure they were a part of this. Not like you guys don't get together all the time already, but with a public health slant. You guys are thinking about fires and earthquakes and floods and car wrecks, and we don't think about the 100-year outbreak. But how quickly that we've been able to fold public health right into what you guys are already doing has been really impressive, and I appreciate you guys too very much.
Yeah, we're very grateful that you guys, the local health department, are communicating and working well with us. We've been blessed with you guys. We appreciate all you do as well.
Sure do. Mayor Pierce, do you have anything?
I just really appreciate the opportunity of being a part of it and doing what I can to help overcome the situation. And I appreciate you inviting me over, and look forward to working with you and doing what we can to overcome the situation we're in.
Well, that's one thing we said we're gonna do. We're gonna involve our citizens, and we're gonna give them an update every chance we can. And we wanna keep them informed, just like Mr. Crabtree's informing us. And, I wanna thank everyone for coming here today, doing this press conference. Thank you, Al, for being here, and Michael Raines, everybody. Thank my staff. And, before we go, I've always said that we're gonna end our conference with a prayer. And tonight, I would like to ask Michael Raines, our county attorney, to lead us in that prayer.
Dear God, Heavenly Father above, please help our city and our county and our country get through this rough time. And dear God, please be with everyone that's been affected by this coronavirus, and be with their families. And dear God, please be with our first responders as they're out there on the front line dealing with this. And please just help us get through this rough time. In Jesus' name we pray. Amen.
And one more thing, I'd like to add one more thing before we go. And that's, let's take this serious, citizens of our county, take it serious, because we're in a battle here. And we need to take every precaution that we can to stay healthy.
A lot of people ain't doing that.
Right. And we just ask you to take every precaution that you can, and we'll get through this with the good Lord's help above. Thank you all.